other senior doctors who are attending today's function, dear members of the Apollo family. And when I say Apollo family, I'm actually talking about almost 200,000 people who have come together in multi-locations for this initiative with a single-minded agenda to just serve the people of our nation and to set a standard and a benchmark throughout the globe. And I think that is what has made today significant, and it has made today special. After all, healthcare it's about caring, it's about focusing. And I think every milestone we reach, every step we move in the right direction is in that single-pointed agenda of doing whatever we can to raise the bar on the delivery of healthcare. Always open, always here is a global first. It was conceived by our chairman, it was thought through by our chairman, who in his earlier days said that the emergency room should never be, it used to be called a casualty room, and he said it should never be a casualty, it should be an emergency room. Healthcare has to be able to reach every individual who needs it. So Apollo Hospital was born from that dream. What can we do to serve the public better? There was telemedicine, many other initiatives. But today's initiative is far more far-reaching than all that we've done over these years. And it truly is a global first, because nowhere in the world do people commit to the fact that all services will be open on a Sunday. All services will be available to people on a Sunday. And you may ask us, saying, anyway, they're the emergency rooms. But it's precisely why we don't want an emergency that always open, always here is being launched today by our chairman. It will have all services available to people. It will have the emergencies available, but anything which they need, which they don't have to wait for, a week slot, will come over the weekends and especially on Sundays. And this is significant because in today's world, there are busy executives working 24/7, and they really wonder, how will I take my aging parents? How will I take my child to the pediatrician? How will my wife really get that consult which she needs unless I take off from work? And that becomes a reason to push things further and further till there are emergencies. And for this precise reason, we're saying that please don't wait, because events don't wait for anyone. Your health is your most important asset. We are there to serve you, and that is why we are available. We're always open. We're always there to serve you. But what is delightful is today, the entire Apollo system, which is 80 plus locations, multiple pharmacies, clinics are listening to what we're saying. So we will start by keeping the hospitals available on Sunday for routine work so that people don't have to wait. We will start by saying that we encourage you to take your preventive checkups. Don't wait for the weekdays and taking time off from work. We're there on a Sunday. Come as a family and prevent the onset of disease. We are available for you anytime if you want to call us in need. So I think this is what Apollo commits to, and it is probably one of the most significant announcements, launches, pledge by the entire Apollo family to raise the bar, to push ourselves further to deliver what we have to do. So I really want to thank the members of the media who've supported us in our journey for over 42 years. And today, all of you have been there to let people know that, healthcare is available to them. They don't have to wait. They don't have to hesitate. And of course, I have to thank our chairman because he doesn't stop pushing us. And there was somebody who said that he doesn't know English because he doesn't know the meaning of the word no or not possible. So thank you, Chairman. The entire Apollo family of over 200,000 people are committed to this vision and to this dream, and to our friends who are there, thank you for your support and for being there. Namaste and Jai Hind. 3 days on works, வேலைக்கு போறாங்க. ஸோ எப்போ அவங்க ஏஜ்ட் பேரண்ட்ஸ் அம்மா அப்பா ஒரு வேலை ஹாஸ்பிட்டலுக்கு போகணும், ஒரு கன்சல்டேஷன் போகணுன்னா எங்கே போவாங்க, எப்படி போவாங்க? ஆஃபீஸில் ஆஃப் எடுத்துக்கணும். Same thing, ladies irukanga, they have to take care of the children, we probably have to cook sometimes, amma pathukano, mother-in-law pathukano, and so there's a lot happening in households. அவங்களுக்கு நம்ம எப்படி ஹெல்ப் பண்ணலாம்? பிகாஸ் நீங்கள் ஹெல்த் கேர் போஸ்ட்போன் பண்ணிங்கன்னா, ஏதாவது ப்ரைமரி கன்சல்ட், முக்கியமான கன்சல்ட்டு போய் நீங்கள் போஸ்ட்போன் பண்ணிங்கன்னா, அது அப்புறம் நம்ம எமர்ஜென்சியில் வந்து லேண்ட் பண்ணணும். இது ஏன் பண்ணுறோம்? ஆல்வேஸ் தேர், ஆல்வேஸ் ஓப்பன்னா, யாரும் எமர்ஜென்சியில் வந்து லேண்ட் பண்ணக்கூடாது. நீங்கள் கரெக்ட் டைமில் டாக்டர்கிட்ட போயிட்டு உங்கள் டயக்னோஸ்டிக்ஸை முடித்தா போய் எமர்ஜென்சியில் லேண்ட் பண்ணக்கூடாதுன்னு தான் சேர்மன் ஒவ்வொரு இடத்துலையும் இது பண்ணணும்னு சொல்லியிருக்காங்க எங்களுக்கு. உங்கள் சப்போர்ட்டுக்கும் நாங்கள் ரொம்ப கிரேட்ஃபுல்லாக இருக்கிறோம். And I just want to tell you that the team is very committed to this. Every Apollo employee சொல்றாங்க, நாங்க வந்து வேலை செய்கிறோம் சண்டே. டாக்டர் சொல்றாங்க, நீங்க சொல்லுங்க, அப்பாயின்மெண்ட் ஃபிக்ஸ் பண்ணுங்க, நாங்க கட்டாயமா வர்றோம் சண்டேஸ்ல சர்வ் பண்றதுக்கு. Diagnostic areas, technicians, everybody is committed to this. Only because we want to do something for our public, we want to do something for the people in our country. But இன்னொரு point இங்க, we all need to know, as Indians, we're all very proud Indians. We want to win trophies for our cricket. We want to put rockets on the moon. But more than anything else, we want now the rest of the world, we want the Western countries, the so-called developed nations, to come and see, look, in India people are doing this. India la indha madri nadakudhu. And so if India can do it, the problems in the NHS, we know the problems in the US. Expensive healthcare, you have to wait for ages. NHS, you have to wait for ages. But here, an institution is saying, don't wait at all, just come. Even if it is a Sunday, we want to come and help you, and we want to come and support you. And I think that is why this is truly a visionary move. This is a move which is path-breaking, and this is a move which we're very committed to. So thank you all for being there, and it is so important for us what we're doing today. Thank you. Operation theatres opened our account. So if you need to schedule a surgery, we can do that. ஏதாவது கன்சல்டன்ட்டை பார்க்கணுமா? நார்மலி கன்சல்டன்ட்ஸ், சீனியர் கன்சல்டன்ட்ஸ் won't come on Sunday. பட் நீங்கள் சண்டே அப்பாயின்மெண்ட் ஃபிக்ஸ் பண்ணி அந்த பர்டிகுலர் கன்சல்டன்ட் who is on duty, who is on call, அவங்களோட ஃபிக்ஸ் பண்ணால் அவங்க கட்டாயமாக இருப்பாங்க, உங்களை பார்க்க முடியும். But the most important is the whole checkup, the preventive health care. You must have checkups. இப்பெல்லாம் படிக்கிறீங்க, youngster, 29 years, 25 years old, heart attack, இதெல்லாம் நடக்கக்கூடாது. So, you must come and have your checkups. Apollo has checkups for every person in society. Our checkup starts sometimes only at 4,000-5,000 rupees, and it goes as expensive as it can get. But, we spend money over one dinner for a checkup. Why can't you just come? And now we are saying, please come on Sunday. So I don't think we can do anything beyond that, and we just want you to stay healthy and stay well.
Ma'am, இப்போ இதனுடைய முக்கியமான ஒரு அஜெண்டா என்னன்னா prevent.
That you have come for this event, which probably change the healthcare of the country and the world, where the only time, and this time is for you. Where the only time, and the time is for you. So this is exactly what we would like to launch today. That the time, we have all the time. So this is where we are always open and always there. Is the thing, and it happens to be for centuries, for decades. Sunday was considered as a holiday. It's good, everybody needs a holiday. But healthcare is no holiday. Because health has no appointments. There's no good time, there's no bad time. There's no, that it will occur exactly at between 10 and 5 when all the hospitals are open, all the doctors are available. So it can occur any time. So I think this is where we probably did. We saw that during COVID. We served during COVID, as you know, with 3,000 beds and over 5,000 hospital beds round the clock. So this is where today's event is going to make a significant thing, and I hope many hospitals in the country, or all the hospitals in the country will follow this lead, and the world will follow it. They followed it. Way back in 1990, when we brought the Boeings, I was asked to be on the board. So in the board, I passed a resolution with 6 other members saying that we should stop smoking in Indian Airlines. So that happened. Indian Airlines stopped smoking. Today what happened? The whole world airlines, there's no smoking. So I hope this event that we are taking place today will be like that. Similarly, I did something like casualty. The day before the president was opened, what all I went through to open the hospital. 5 years of struggle. I came to Delhi first time as a tourist. Second time I came to Delhi to bring this major healthcare service to our people, and 50, 100 trips. But then all that today is behind us. Number of hospitals, Apollo has hospital, good hospital, then another 200, 300 good hospitals in the country. So all of them are now following this. They all had, previously, the hospital had a board called casualty. So the night before the hospital was to be opened by our President of India, State Singh, I saw the board. I went to them and then said, what do you mean? The patients are coming to you to become your casualty? So I changed the board to emergency. So the whole world has changed it to emergency. Well, like that, I think what we need is to think saying, we are in healthcare, and people should trust us. To be enabled for them to trust us, what can we do to make things better? I'm happy to say the journey of 43 years have been very, very, makes me happy, makes me strong, saying that, today, no Indian need to go abroad. I think I must have told you before, I'm a cardiologist. I came back from US, and when I came back, I could do everything that's possible in cardiology. But if the cardiologist can do only so much without intervention. Today, they can do intervention and do so many things, but that time intervention was not available. Only surgery was available. But people who couldn't, who needed that, very few could afford it. And I told the then Prime Minister, there are only 1 or 2% of the people whom the government and the rich can afford. But all other people are unnecessarily succumbing to this cardiac problem. And that's only, cardiac is only one problem, but we know now today, oncology is the biggest problem. But in all of these, I must thank, yes, they all say my daughters. It's not my daughters alone. It is the management team. It is the entire 125,000 Apollo family members and the 300 other good hospitals who have made this huge transformation in healthcare so that no Indian need to go abroad for any treatment. You all happy? This is what it is. This is what happened in the last 43 years. It was not a difficult journey because path was difficult, but our emotion, our satisfaction kept us going and brought this. I must thank again all my doctors who adopted the latest technology. First, the Apollo is known for bringing the best possible technology. I brought the first CT scan in the country, whole body CT scan. Today there are 2,000 CT scans. Similarly, cath lab, whatever you mentioned. And I brought proton. There was no proton in UK. There was no proton in the whole of Asia. No proton in Singapore, Australia, nowhere. We brought the first proton. That's full. 40% of the patients there are from foreign countries. We're now putting one in Hyderabad. It's held up because of Trump. And so So the patients who are waiting for Hyderabad, we will put one here. But whatever we do is, we won't put the same proton. We'll put the proton of that day's technology. This is where, what's coming in Hyderabad, it's called proton protease. We'll put one here. We'll put the technology of 2028. This has been our continuous process. With all of these, I'm happy that Indian healthcare is attracting, not only giving good healthcare for our people. Over 500,000 people last year, I believe, came for a treatment abroad, for treatment from abroad. This message will help, which it will go, will continuously grow, and I think, I believe that the healthcare in many of the countries today, and most of the countries today, is not up to the standard. Not either not available or not acceptable. This is where I think the 300 odd hospitals that have come, we will grow. Apollo has put up already three hospitals this year. We'll put up another 5-10 hospitals in the next 5 years, but we'll keep on. Others will put more hospitals. So I think India will have adequate healthcare facilities for our country. I must also compliment the government. The government has done tremendous lot. It's not enough, but they are making an effort, and together we'll work together. Private, public sector will work together to make Indians healthy and happy. And this one factor that we are today, that we are always open, always there, will be another major factor, because sometimes you work very hard during the week. The lady is at home alone. If she has some suffering, there is nobody to take her to hospital. And then you are busy, so you ignore your symptoms. And unfortunately, I'm being a cardiologist, I always refer this saying, Indians get heart attack at an early age. I mentioned this in 1984 in the American College of Cardiology meeting. One of them, doctor said, Dr. Eddie, Indians don't know the date of birth. I said, don't be foolish. They not only the date of birth, they know the star on which they are born. In 1981, 7 years later, 3 doctors did get up on their duty, all 3 of them are Indians. Then hell broke out. They said, they eat ghee, they eat coconut oil. I said, I know Kerala patients are no more than other patients. My mother-in-law eats ghee, not a teaspoonful, tablespoonful. At 80, she is perfectly healthy. But then it's 81 when they realized. Then they said there's a famine about 3 centuries ago, which altered our gene. So I think it's very important. Even very recently this week, continuously I'm listening. Every week I get something that a young person that is 30-year-old. And even Apollo starting was when I lost a young man, was only 38-year-old. So I think it's very important that Sunday is open. Sunday is all, many institutions will follow it so that you will be able to continue with it. If you say, Dr. Reddy, is this all that you are doing? No, it is not. Because India today has come to the forefront of healthcare. We must give it to the world. There are 2 suggestions that I wrote to our Prime Minister, saying that India should declare as a global healthcare destination. When it was global healthcare destination, I gave 8 steps how this can be achieved. Another suggestion that I gave it to him was that in India, the world is going to be short of 9 million doctors, nurses, paramedical. So only India can have that younger group of 20 people. If we train them, they will be able to serve not only India, they will be able to serve the rest of the world. I appreciate that idea. I came with my 4 Shaktis. My wife said, why not me? So he said, yes, of course, ask her to come. He said, very first thing he said, I like these 2 concepts that you have given. But only thing, I want to make a change. I don't want to call it a global healthcare destination. I want to call it Heal in India. because he said Susruta way back in in the 7th century started medical diagnostic, medical treatment. So I said, fine. The second thing is he said, let's call it not global workforce, call it Heal by India. So these two things he accepted. And my daughter, Sangeeta, she started the third to Heal the world from India. So we have hospitals from US, one largest chain, US chain, that is connected with us. We advise the doctors, the nurses, the paramedics, what next to do. So I think the time has come, that is come. But when Heal in India, they did a lot of steps. They opened 49 medical colleges last year, 10 this year, 11 this year. They opened 100 new nursing schools and made a nursing admission of 70 to 300. So you will have sufficient number of people, almost close to 1 million extra healthcare people will train in India for our use. Because we need to expand. We need another 250 beds in India to meet our needs. So to meet our needs and to meet the global healthcare needs. So I think we will continuously work towards this goal now. Suddenly the various ministries have woken up saying, what shall we do about Heal in India? Because Pakistan war, then the West Asian crisis stopped all of those. Now they're restarting the whole thing. In the matter of next few weeks, they promise they'll launch the whole thing and reach our goal of Heal in India. That's our pride. That we
are thinking from the Niti Aayog point of view, from the Government of India point of view. We are not looking at healthcare as just a treatment. The entire spectrum is now with the things. It starts from the prevention. You go to the lowest of the last mile institutions which we have. The prevention is something which we have taken most important thing for us. And then comes the health promotion. You know, what we are seeing today, the casual nature has been removed by the chairman. I think give a big hand to him that he has removed the casual nature in the hospital, not the casualty, in addition to what he has done. So somewhere the health promotion going on to the early diagnosis. That's where the initiative, what is being told today. And of course, the treatment everybody remembers, rehabilitation everybody remembers, and the palliative care is something, the geriatric care is something which is being added up. You know, the entire spectrum of the thing, right from the prevention to the palliative care is something which the government institutions are doing and the private institutions are complementing with that. And I'm very happy that when the chairman sir said that the government of India has done enough and very much. And then I'm happy to share with you the flagship program of what has come from us is the PMJ, the Ayushman Bharat scheme. You know, today the person who can't afford, he has the card and then the trust and the belief that, you know, if something goes wrong, there is a possibility of not only in the government hospitals, but also in the accredited and empaneled private hospitals of the country.